It's an incredible responsibility, caring for an entire region of people, each with a different story, a different need, and a different perspective about what makes their community great. But it's a responsibility that we accept wholeheartedly. And there has never been a better time to embrace our position as the region's leading healthcare provider and to truly make an impact on the communities we serve.
Hamot has really been here for 130 years and has been an absolutely important player in this community for all those years, both from a healthcare perspective, from a quality of care perspective, medically, clinically, but also as a very strong and representative community leader. This has literally been one of the most dramatic years of change in Hamot's history. Women's Hospital, UPMC affiliation, both essentially in the same time period. One alone would be monumental, but when you combine both of those things having happened in a very short period of time, I think it's a dramatically important, significant, very positive thing for this community, for our patients that we serve, and literally for this region for generations to come.
Well, I know the day I got the call, that every mother has a hard time with. You know, there's been an accident, come to the hospital.
Driver was actually going pretty fast, about 75. Our car lifted off the ground, and when we came back down, we hit potholes and started to fishtail. We flipped over once. I lost consciousness, as far as I can remember, right before we hit. The back half of the car, all that was left of it pretty much was the back seat and the trunk. I looked down and I saw that my right leg was broken and then my left foot was gone.
I was on trauma call as an orthopedic surgeon and part of the trauma team. Alex had been in a car accident and he'd suffered some very severe injuries. He'd had an amputation of his left leg and he also had a very severe open fracture of his right leg. It's hard when you see children and teenagers as trauma patients. I'm a father and I have 3 teenage kids, and it always makes me feel a little different when I get a teenager or a kid that's been in a bad accident.
I was at UPMC Hamot for about 6 weeks. I was in the ICU for almost 3 days.
We had to do some temporizing fixation of his right leg in order to save that leg. That was my biggest concern. Actually, it wasn't the amputated leg, which most people would be worried about. I knew that would heal and he would do well. It's the other leg that he was able to save, but had severe injuries, and he's still rehabbing from that. But we were able to transfer him to Children's Hospital in Pittsburgh as part of our overall greater healthcare system. We're very fortunate to have this large network of kind of expertise to rely on in the region, and including Pittsburgh, to be able to help care for patients like Alex.
I almost had a near-death experience, so just live life to its fullest, be happy as I can, because that's all there really is to it. Just being a positive attitude makes it so much better.
I just thank them from the bottom of my heart for saving my son's life.
I went to lay down, and then when I had got up, I had lost my balance and hit the wall, and that's when I fell on the floor, and I was trying to get up, but I was I couldn't. I would fall back.
Nicole's daughter was able to get Nicole into UPMC Hamot in a timely manner. It's very important when you have a stroke, even if it appears to improve, it's important still to go to the emergency room.
I think they had told me that I had a blood clot and they had to do immediate surgery on me. And that's when they went in on my side and went and got it off up here.
And she came in with an NIH stroke scale of 17, which is quite severe. 0 is normal, 17 is very high.
I would have never thought my age somebody would have a stroke.
She's a 36-year-old patient, but it's not unusual nowadays to see a younger patient. The population is becoming younger and younger for those individuals that have strokes.
I got excellent care. They was real nice in ICU and everything. They were great. They treated me like I was family.
Our bodies are a wonderful mechanism that God has created. And now He has created a lot of wonderful people that can tell what's going on with their body.
For some time, I had wanted to do something at UPMC Hamot in regards to women and heart disease. The Wear Red event consists of screenings where people can have their cholesterol checked, blood pressure, body composition. We also have speakers who talk about various topics on heart disease. There was a patient in the hospital by the name of Laretha Johnson, and she had attended the Wear Red event and had gone to her family physician after one of the talks that she had heard about risk factors for women in heart disease. She had a stress test and then needed a heart catheterization, and from there received 2 stents. So while she was in the hospital, I was the nurse who went in and did teaching with her, and she had asked me if I knew why she was there, and I said no, and she proceeded to tell me about the Wear Red event.
Health screening is very important because it leads to a diagnosis of what illnesses and illness you may have, and those types of things reveal what you can't see. And many times it's like my heart, it reveals what you can't feel.
Laretha was pretty typical in terms of the problems that we're seeing with women specifically. She cared for her husband. She had some symptoms that I wouldn't say she ignored, but they weren't her highest priority in life with all the responsibilities that she had. And then as things kind of got worse, you realized that there was a critical problem, and that you finally and fortunately sought medical assistance before something catastrophic occurred.
And far as I'm concerned, we are the most lucky people in Pennsylvania to live in Erie, PA, because there is almost nothing here that you can't have access to.
We've known Jan Coca for several years. She actually has had 3 family members in our hospice.
I became involved with hospice first with my mom, who was a COPD and congestive heart failure patient. And then after she passed, my first husband passed 11 months later with cancer. And in the meantime, I was caring for my dad, was an Alzheimer's patient. So in about 1.5 years, I had actually 3 experiences with hospice.
Her experience with hospice was so wonderful, and also with the volunteers, all the staff of hospice, including the volunteers, was so great. That's why she ended up being a volunteer here at Great Lakes Hospice.
I find it very fulfilling for me to know that I can provide something for someone because I have been there and I know what it's like. And the hardest thing is when they pass and you get attached to them. It's a warmth that I feel when I am with these patients and their families, and they're very appreciative.
Volunteers go into patients' homes, they can go into the nursing home, into the hospital, sit with the patient, sit with the family, run errands, do little household things for them, do cooking, just provide that extra loving, tender support that a patient needs at the end of their life.
It's so fulfilling for me to be able to help somebody. I love it. I don't ever want to quit.
I would have to say that what Janice just got done saying is what typifies her as being a great person. She is a very warm and wants to help, and that's what she does, and that's what makes her feel fulfilled.
At UPMC Hamot, embracing our community is part of our nature, and there's an inherent spirit of volunteerism that underscores everything we do.
The patients at St. Paul's Free Clinic is a variety of patients. Some of the patients I act as their primary care provider, and I see them every month or every other month. There are also patients that come in for acute problems, such as simple things as sinus infections, urinary tract infections, etc.
Here at St. Paul's Clinic, we see what is termed the working poor. These are people that usually have 2 and 3 jobs and at minimum wage and trying to make ends meet. They have families. Without the compassion and care of such volunteers as Dr. Hutzel, the clinic wouldn't be able to operate.
One of the main reasons why I like to volunteer at St. Paul's Free Clinic is because I love practicing medicine. And coming here, you can practice in medicine in the most pure form. It's just me, the patient, the chart,
and a very eager volunteer nurse that wants to help out as much as she can. And I feel that it's our duty as citizens and as people of this community to give back.
Many folks don't realize the thousands of hours that Hamot's people volunteer in the community, in social service agencies, in the United Way, in the Girls and Boys Club. You can go on through a litany.
Hamot employees reaching out into the community is nothing particularly new. And I think the one thing about Hamot that I realized 21 years ago is that people, when they clock out, don't clock out. Their job, I mean, they're Hamot community-oriented people 2 hours after their shift ends. That's just the way that the people here are.
In January 2011, the UPMC Hamot Women's Hospital opened its doors, enhancing the delivery of care to the women and children of this region and strengthening the bond between UPMC Hamot and its community.
I think one of the strengths of Hamot, and I say this somewhat as an outsider, is its incredible relevance to the community. And I think that was evidenced to me really last winter when we did this opening of the Women's Hospital. And it was a snowy, wintry day, you may remember, and there were hundreds of people who actually came to the opening and were crowding in the lobby, really so proud of something new in the community.
In the first 9 months, we've been able to triple the number of deliveries that have been done here at Hamot, double the number of GYN surgeries that have been done here. And probably for the community, the biggest thing we've been able to accomplish is to add a lot of new services. That gives the community this ability to have really total comprehensive women's health care here in Erie now. You know, Mr. Malone always liked to say in the past that why not Erie, why not Hamot? Well, when it comes to women's health care, it is now in Erie, it is now at UPMC Hamot.
And even though my news wasn't horrible, it was stage 1, but all I heard was cancer.
She was actually one of our first patients that we operated on in Erie. And so kind of a test case which went very, very well. Lucky for Joanna, her pathology was very well differentiated, early stage cancer. She won't need any other therapy, and I suspect this will never bother her again.
My family told me that after surgery, they said Dr. Commercy literally was skipping out. He was so happy, and they were just, you know, they could just tell by his body language everything was okay.
So as an oncologist, we rarely, well, I shouldn't say rarely, but we often give more bad news than good news. So for me, it was a little bit of a treat to be able to, it always is a treat to be able to tell somebody that they don't need anything other than what they've already had, and that the prognosis is good.
I want to go on a vacation in the women's hospital, and I am not kidding. That room was incredible. I could not rate the nurses. Every one of them was 5-star. And I'd be thinking, okay, well, the next one could not possibly be as good as the morning nurse. Every single one. I could not rate them. They were just so wonderful, every one of them.
The new women's hospital is amazing. It is a very well-run facility. From an aesthetic standpoint, it's beautiful. The OR is extremely well-run.
It's my understanding that there are not enough patients in Erie to support a doctor like Dr. Commercy. So by having this partnership with UPMC, we're able to have the Dr. Commercy and the Dr. Commercies of this world come to Erie to help us.
UPMC is working closely with Hamot on it continuing its mission to serve. Our philosophy is completely congruent with Hamot's, and we're really here to serve our community, to serve our patients.
We're beginning to see the fruits of that in terms of the affiliation being able to enhance the care that's now provided not just here at UPMC Hamot, but enhance the care that's provided throughout the region at the regional hospitals and communities.
The greatest thing about the UPMC Hamot partnership with Kane Community Hospital is it really brings technology and services to the rural communities that patients would normally have to drive for. Well, we've just experienced the most successful year financially that the hospital has ever had. The stability factor has quite an impact on how employees feel about coming to work every day. And we've noticed significant improvement in our employee engagement surveys this past year.
I don't think the importance of a resource like UPMC Hamot to our region can be overstated. Hamot's been a part of this community and embraced this community and taken care of this community for over 130 years. Now, of course, the UPMC affiliation will ensure that Hamot's able to continue to embrace the community well into the future. And I believe, as do my fellow board members, that there's really no better cause to devote your efforts and your time to and your expertise to than the betterment of healthcare in our community, both for our citizens today and for our kids in the future.
The most extraordinary part of this place is the people who have made it what it is today, the people who are here today and are doing extraordinary work, and I'm confident the people who will be here in the future that will make that constant and that legacy continue for generations to come.